Assalamu alaikum. You are listening to the Mari Mukwanda show on Salam Media. It is 11:35 on this lovely Monday, the 12th of October 2020. The lifetime risk of prostate cancer in men in South Africa is 1 in 19, according to the 2014 National Cancer Registry. Prostate cancer is the most common male cancer globally and locally, and showing significant increases. Prostate cancer is a cancer that occurs in the prostate, which is a small walnut shaped gland in men that produces the seminal fluid that nourishes and transports sperm. To tell us more is urologist Dr. Salim Choonara. Assalamu alaikum wa rahmatullahi wa barakatuh, Dr. Choonara.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you for having me, and salams to your viewers and listeners as well.
It's a pleasure, and shukran for always being here and making the time for us. Now, please elaborate on the brief description that I just shared about prostate cancer.
Yeah, so as you correctly described it, it's a walnut sized gland. Obviously, only found in males. The location of the prostate is just below the bladder, and when males urinate, the urinate flows from the bladder. It's got to flow past the prostate through the urethra, and obviously then expelled in that way. So that's almost the location of the prostate. Prostate cancer, yes, it is a common type of cancer, and also regarded as a significant cause of death worldwide as well. If you look at some of the information around, especially in America, definitely among the top 3 cancers in the American population as well. And even in South Africa, we do see relatively common, hence all the drives and show like what you're doing exactly now to create awareness as well.
Mm-hmm. All right. Now, how common is prostate cancer, especially amongst people of color?
Okay. Yeah, that's an interesting one. If you look at I'll just mention a little bit about the American information, the data they have. They do see the cancer is also more common amongst the African American population. And in that group that develop the cancer, they tend to have more aggressive type of cancers.
Mm-hmm.
In South Africa, if I just look at my own experiences with my own patients as well, I also do find that when we find the cancer among the let's say the non-white population, they definitely tend to be a little bit more aggressive type of cancer, and it tend to occur in a more younger age group, earlier than what would occur in the white population. So we do see that. Yeah, it is common. I mean, we do see it relatively common. Probably in the order of close to about 30%. There is definitely an increase in the incidence of prostate cancer. There's also a slight criticism regarding that, because remember now what we're doing also is that we are checking for it. We do what they call screening, and we're looking out for people that may develop cancer. Hence, if you look at the incidence worldwide of prostate cancer, it has gone up simply because we're now looking for it. Whereas in the past, people would come with very late diagnosis of cancer. They would come with it when it was now almost at the end of the line or end of the road for them. So that has also led to increased incidence. Just because we are now also purposely making people more aware of it, we're testing more frequently, and people know about it. People also want to ask about it, want to check for it as well. So hence the incidence has gone up a bit. So that's an important thing to keep in mind as well.
Mm-hmm. All right. Who is most at risk of getting prostate cancer and dying from it? I know you mentioned age groups, and it can become a bit more aggressive than some people. So who is at risk?
Yeah. There's an interesting dynamic about prostate cancer. So often even advises to my patients. It's almost like the disease of 2 extremes. So cancer of the prostate picked up early tends to have very good outcome, very good treatment. Patients live long, they almost can cure the cancer. And then the other extreme is the cancer picked up very late, where it has already spread to different parts of the body, can have a very aggressive outlook and can lead to death in those individuals. In terms of the age or who's likely to get it, for one, look, what we advise the individuals to do is to at least start checking for prostate cancer from the age of, if they have a family history of prostate cancer, that will put them at risk, especially the familial type of cancer. So in other words, if there's somebody your family has a cancer, maybe under the age of 50, that is significant. That they could suggest some familial tendency to develop cancers in that particular family. So we would advise those individuals to have their prostate checked earlier, maybe at age 45 or even at age 50 to have a baseline test. And then the clinician will decide, okay, based on that, when would we see this patient yearly or every 2 years to regularly check, all right? Amongst, the thing is, if we had to ask the question slightly differently, what causes prostate cancer? The answer is we don't actually know. We can't say this is exactly the cause of it. We just have an idea of possibilities that may predispose someone to developing cancer. Age obviously is one factor. The older you get, the likelihood of developing cancer is higher. Familial history or family history of cancers, even other type of cancer, for example, like cancers in the female, of ovarian type of cancers, cervical cancer, endometrial cancers, can have some sort of similarity, some sort of overlap or corresponding causative factor for male cancers leading to prostate cancer. Okay, there are other general issues around cancers, such as obesity, general an unhealthy type of lifestyle. These are some of the factors that one is not considering as a predisposing, as a risk factor that can cause the normal prostate cells to start changing and dividing to become cancerous. So obesity is a very big thing, because it's regarded as a pro-inflammatory state, and that can cause inflammatory changes to the cells, and it can lead to a trigger to also developing things like malignancies and cancers later on. So there isn't really a cause for it, but we've identified certain risk groups that they should be aware of prostate cancer.
All right, and what are the symptoms?
Yeah, I was going to get to that. So to say that there are symptoms of prostate cancer, no, they aren't. So I can't say, for example, these 3 or 4 symptoms will lead to says to us an individual has prostate cancer. It doesn't mean that. However, in males as they age, naturally as the prostate gets bigger in size, as I explained to you earlier, when they urinate, the urine got to flow from the bladder almost via the prostate and come out through the urethra. Now, you can think of it almost like a plumbing situation. If the tube gets narrower, the diameter gets narrower because of an enlarged prostate, the ability of the individual to urinate is affected. In other words, they have more difficulty urinating, they may have to strain to urinate, they may go very often to toilet, they may wake up at night to go to toilet. So all the irritable effects on the bladder. That's not to say that that causes prostate cancer, but what that will say to us is that this individual should have their prostate assessed. That's what it will mean for us, okay? And in the process of checking for prostate cancer or checking that individual, one may or may not find evidence of a prostate cancer. You see what I'm saying? So it will almost like get the individual the evidence of cancer. Okay.
All right, Dr. Choonara, we're going to take a quick break, but we will continue thereafter. And I'd like to know about something called...
Just lost sound there.
Can you hear me now? Dr. Choonara, can you hear me? Is it fine?
I can't hear you, Mariam.
All right, so we're going to take a break, and we'll continue after the break.
Mariam? Hello, can you hear me? Can you hear me, Mariam?
Yes.
Our internet is down.
Seriously?
Yeah.
So even this year, that is live.
money will be out of Prestige for free. What if the government takes it away then? I don't think it works like that. I tell you what works. Gold. At your age, I invested in gold coins and it paid for your university fees and your wedding. More contracts, more agreements. Your investment is in your hands and you own it. With a 70% growth in only 5 years, do you still doubt gold investment? Contact RJ Coin today. 031-202-4701 or visit them at 151 Stephen Lamini Road in Musgrave, Durban. Bradbury Jewelers Gold Coin Exchange. Your passport to gold investment. As the crisis in Yemen continues, 80% of the population are in desperate need of basic necessities. The African Muslim agency teams are on the ground undertaking emergency relief efforts. Come to the aid of the people of Yemen by donating any amount now towards food, shelter, and medication. Contact AMA now on 011 834 8685. Africa Muslim Aid. Inspiring. Of giving.
Connect and stay ahead with Salam Media. This is Salam Media coming to you live from South Africa.
Welcome back. You're all listening to the Mariam Mokwanda Show on Salam Media. And we are talking about prostate cancer as October is Cancer Awareness Month. I am chatting to Dr. Salim Choonara, who is a urologist and giving us some information about prostate cancer. Dr. Choonara, are you there? Can you hear me now?
Mariam, I can hear you now. Sorry about that.
All right, alhamdulillah. And sorry about any technical difficulties that we had earlier, but let's move on, inshallah. So, Doctor, what is the Gleason score or Gleason grading system?
Okay. Yeah, so basically, so if we go back to the index patient we were talking about, right? So you're a guy who's got some symptoms, goes and visits his urologist, and in the process of checking, they may find that the prostate gland feels abnormal by way of a rectal examination or by way of the blood test, what we call the PSA, may be elevated, for example. Now, the clinician will decide whether or not there's a significant risk that this individual may have prostate cancer. Now, remember, just looking at a blood test, looking at and feeling the way the prostate feels doesn't mean the patient has prostate cancer. One has to prove that. So how do you prove that? You have to do a prostate biopsy. When we do a prostate biopsy, that's something that gets done in theater or under local anesthetic, depending what the discussion is amongst the clinician and the patient. And then based on that information, based on the biopsy is a specimen, some tissue that gets sent to the laboratory for analysis, right? And when the pathologist analyzes that specimen, they will indicate if there is a cancer there, they will indicate that cancer grading by using a Gleason score. So the Gleason score will tell the urologist whether we're dealing with a low-grade cancer, an intermediate-grade cancer, or a high-grade cancer. So it's really more, it's really more for the doctor to decide based on the Gleason pattern, where does this individual fit? Why is that important? That's just important because if you know which category this individual is placed in, based on the cancer, is it a lower grade, intermediate, or high grade, that has an outcome that determines the extent of treatment. So we will know whether this patient needs a single form of treatment, multiple modalities of treatment, etc., etc. So that's how the Gleason pattern helps us. So it's a histological diagnosis. It's from the laboratory, and based on that information, the clinician will decide how to treat that individual.
So how do you detect prostate cancer? Is it similar to breast cancer that you can touch and feel if there's something that's not right?
Okay. Yes. So the touch involvement here is regarding the rectal examination. Most males don't want to see the urologist because they don't want to have a rectal exam. But it's actually a very, very important exam because it allows us to assess that individual's prostate. So you know how the gland feels. Is it soft? Is it hard? Are there bumps on the prostate? Are there nodules on the prostate? Is it very enlarged, etc.? It gives us a lot of information just from feeling the gland, But obviously, it's not like the breast tissue, which is easily exposed in terms of the female can do it themselves as well. Here, an individual needs to see a clinician, a doctor, GP, specialist, etc., to have their prostate assessed.
Mm-hmm. All right. So, what treatment is available for prostate cancer, and can alternative medicine like perhaps natural herbs also assist?
Yeah. So look, let me mention a point about the natural herbs, right? I mean, there are some reports regarding the use of natural products regarding prostate health. You know, if you go to a local pharmacy, you find there are numerous things on the shelf that will tell you, okay, you can use this to improve the health of your prostate, etc., etc. But in my view, that's very different when you're dealing with prostate cancer. Once you've made a diagnosis of prostate cancer, then you know, I'm not inclined to suggest to my patients that now you should go and look for alternative treatment methods. Thinking that that's going to treat the cancer. We know very clearly what prostate cancer is all about, and in the last 10 or 12 years, there's been a revolution in how we treat prostate cancer. It's very unlike other cancers. The cure rates for prostate cancer are phenomenal. For your low-grade, intermediate-grade prostate cancer that are localized to the prostate that has not spread beyond the prostate, the treatment outcomes are excellent. Your cure rates are over 90%. So people can live a good life for a good 15 years. Being disease or cancer free. So one can accomplish that even longer, even up to 20 years, perhaps. Depending again on the grade of the cancer. I'm just giving you a very overview. But the point is that there's very good modalities of treatment available, and all those modalities are available in South Africa. Whether it's the surgical techniques using a robot, whether it's radiation treatment in the form of brachytherapy, whether it's chemotherapeutic agents, whether it's hormonal therapy, whatever it may be, it's available in South Africa. And so, based on the grade of the cancer, as I said to you earlier on, what we tend to do is we tend to combine certain aspects of treatment. If, for example, if someone has a low Gleason score, they may only require one modality of treatment. If they've got a more higher grade cancer, they may require radiation treatment and hormonal therapy and maybe something else. So based on the grade of the cancer, we'll decide how to combine these different forms of treatment to effectively manage the cancer.
Right. So we've heard about prevention, the saying that prevention is better than cure. So, are there any tips and advice for prevention of prostate cancer?
Okay, so as I said to you earlier on, there was a lot of talk about saw palmetto and all the other natural products that one can use in terms of
Yeah.
as a chemopreventative strategy. That has sort of hasn't been proven in the literature. Although people still use it, but there's no hard and fast proof for that. There is no real specific thing we can say, do this to prevent prostate cancer. All we can advise individuals is to be aware of it, to have your regular checks. If you know you have a risk of family history of cancer, you want to go to your urologist early, have a baseline check of your PSA. How does your prostate feel? So okay, you know what, this is where I'm operating, and I need to see the doctor again in 2 years or 3 years. So I think regular checks are important so that we can detect the cancer early, what we call screening. It's an important test, right? The other thing is the general health, as I said to you earlier, avoid things like obesity, eat healthily, exercise regularly, look after your health. And this applies to generally male sexual health, or male health network. We encourage this in totality, not just only related to the prostate. Even when it comes to things like, for example, the metabolic syndrome, and maybe it's for another discussion, men, they tend to put up a lot of sort of the belly fat, the implication that it has on their heart, on their testosterone levels, on the intimacy, on the prostate, etc., etc. I think living a good, healthy lifestyle and avoiding obesity and looking after your health in general is a good step. And then the awareness of what prostate cancer is, and having your regular checks, I think will go a long way in terms of decreasing the morbidity and mortality from prostate cancer.
All right. Shukran so much for your time, Doctor, and for that knowledge and insight. And I hope that our listeners can take advantage of the information we just shared, because, prostate cancer, like you mentioned earlier, it's becoming increasingly common. And if we don't do anything about it, we're probably going to be losing a lot more to prostate cancer. But shukran for your time.
Zakira, thank you so much for having me. I appreciate it. Assalamu alaikum.
Walaikum salam wa rahmatullahi wa barakatuh. That was Dr. Salim Choonara, who is a urologist, giving us some information about prostate cancer, what it is, the symptoms, the diagnosis, the treatments available, and alternative medicine is probably not the way to go down. You have to go for the other medications or treatments that are available, and it will also depend on the Gleason score that you have, if it's a good one or if it is not a good one. All right, let me tell you about the competition quickly with the few minutes that we have. Over the last 6 months, South Africa has witnessed a full-scale disruption of activities in our country. COVID-19 has not only changed the way we conduct our daily lives forward, but has also made us realize the value of human lives and the importance of our well-being. Whilst we may never return to our old normal, we should not despair of hope. We should work together to build new meaningful memories with our family and friends. Salam Media, together with its platinum sponsor, Quantu Private Game Reserve, are embarking on a 2-night exclusive stay for a couple at the legendary Quantu Private Game Reserve. Situated approximately 100 kilometers outside Port Elizabeth in the Eastern Cape, the Quantu Private Game Reserve boasts the perfect getaway opportunity for a couple. Set in a tranquil and serene environment of up to 6,000 hectares of natural ambiance, be surrounded in the company of the Big Five with daily safari game drives, indulge in exquisite halal cuisine, and pamper yourself or your loved one during this exotic stay. Tune in daily to Salam Media for details on how you can enter and participate in this competition. The Salam Media and Quantu Private Game Reserve 2-night getaway is a project of Salam Media. Competition starts on 12th October and ends on the 2nd November 2020. For details, you need to follow Salam Media on Facebook, Instagram, and Twitter. And obviously, if you look for us, it's at Salam Media. And Facebook, it's facebook.com/Salam Media. It's one word. It's Salam Media. Don't add a second M. 2 A's, 1 M. Salam Media. All right. And the time slots for the competition are as follows: at 9:45 a.m. Monday to Friday, 12:45 p.m. Monday to Friday. Okay, so it's all Monday to Friday. 9:45 a.m., 12:45 p.m., 15:45 p.m., 19:45 p.m. That's 7:45, and 20:45 p.m. That's 8:45. Salam Media is broadcasted on online satellite 90.4 in Durban, 105.6 in Pietermaritzburg, and 88.9 in Polokwane. And if you would like to get some more information on WhatsApp, the number is 061 766 0355. I am looking forward to our first 2 contestants of the day who will be coming up at 12:45. And if you think you have what it takes, make sure that you tune in, but also make sure to enter the competition. It is 11:58 on this Monday, the 12th of October, 2020. Do stay with us. We will be right back.